For more perspective now on the new health care legislation, we're joined by Dr. Sreedhar Potarazu, President and CEO of Vital Spring Technologies. Reporting every transaction over $600, that alone means an onerous amount of paperwork.
Tremendous for businesses, as Rich said, for insurance carriers, for doctors, for pharmaceutical companies. In fact, by September 23rd of this year, insurance companies have to start reporting on some of their coverage. They don't really have a lot of time. And if you go through the 2,000 pages, which I know both of you have looked at some of it.
Absolutely. And the footnotes, everything.
But every other line stipulates you've got to provide data to the secretary. And the word secretary, I haven't counted yet in terms of how many times, how much information
Secretary of HHS. Right?
Secretary of HHS. It's enormous. And so the amount of systems and data that has to now be transmitted about coverage, how much they're spending, whether the coverage is okay, whether they're providing the right care is a huge task.
Let's reverse this, though, back on the insurance companies. And I say this because back in the 70s and 80s, when HMOs became a big deal and the insurance companies really came to the forefront of healthcare coverage, I know many doctors, including my dad, who had to hire an entire team to deal with the insurance filing and the paperwork, and it was a nightmare. So this is nothing they're not used to, engendered by the insurance companies.
Absolutely, Liz, and it's going to happen again. So that doctors are going to need to staff up in terms of how to comply with implementing. They need help in just implementing these systems. Businesses need to know how they need to report, because every month you've got to tell the IRS or somebody how many people you're covering, how much coverage you're providing, if somebody's in fact participating in the exchange. Imagine the amount of data that has to be processed, and the cost of that, which we've talked about before here, is not factored in. I mean, the state of Florida made a note that they're going to spend, it's going to take them about $150 billion in the first year. And going forward, $150 million and then about $1 billion per year in out years to just implement the state-level exchanges that all of the states have to put in place over the next 3 years. And none of that is factored into the cost of the new law that's passed.
What about the big write-offs we've been seeing, or the big costs we've been seeing by companies like Caterpillar and AT&T and others, up to $1 billion in costs? These companies are now going to be hauled up in front of Congress to actually account for themselves when they say, hey, look, it's the SEC itself that says we have to account for the costs of retirees. So we're just following orders.
The SEC, by SEC standards, they have to. The irony here is that Henry Waxman has called these folks to come and testify on April 21st, all the companies you've mentioned,
the Energy and Commerce Committee.
Yeah, about the methodology. But you know what's even more ironic? The methodology for which they calculated these numbers on the prescription drug benefit is the same methodology that CBO has used to score the bill. It's using actuarial estimates. So should we be going back and asking Congress, well, if you don't like these methods, well, then how does it speak to the methods you used to talk about how much this bill is going to cost?
Sitting here, it sounds like a whole new cottage industry has to sprout up around this, which means job creation, David.
Hey, that's one way of looking at it, at taxpayer expense. That's the problem. Right. It comes out of our pockets.
It could. Well, look around Sarbanes-Oxley.
I was just going to say Sarbanes-Oxley had to hire accountants.
Yeah. Well, look how much of a business was driven around Sarbanes-Oxley. You're going to see the same kind of cottage industry amongst auditors and consultants sprout up. Maybe it'll create new jobs, but it's a whole new service industry that has to help all of these people.
But you know what? It may create new jobs, but it's distracting from the main business at hand. Companies are in business to do a certain thing, and if they have to spend their money on something else other than their main job, it distracts from it makes the country less efficient.
And will they? The big question is it going to be cost effective? I was just talking to the CEO of Ladders.com in the green room. We were saying, so as a small business owner, is it going to make sense for them to be able to maintain coverage for their employees, or is it cheaper to just pay the penalty? When you look at the impact of the subsidy, you know, that's the question that still has to be answered.
We'll soon find out, because you'll start to see the trend of how people behave in ways to either deal with this or get around it. But again, sounds like we're dealing with that sort of insurance company doctors issue back in the 80s. More paperwork. You got to hire people to deal with it.
We are back to managed care, and that's, I think, the bottom line. We're back to managed care all over again.
You said back to managed care, but people are looking towards the future. I remember a couple of senators, Tom Harkin and others, saying this is just a starter home. Yep. We're working our way towards single payer. Is he right?
I think if they don't go to the single payer system and they stop at this, then it's really ignorant. So If they really have a plan in place, then the only way to justify all of this is to go to a single-payer system, and that's what I see coming down the road. But I think, again, as we've said, the amount of time people are going to wait to get care and how much they're going to spend is going to go through the roof.
Dr. Sreedhar Potarazu, he is author of Get Off the Dime. We both have the book.
2 copies.
Thank you.
Thank you very much.